affects the structure, the structure or function of the heart. So we talked about those vessels that sit on top of the heart, on the surface of the heart, the vessels that run through our body. And we'll learn tonight that anytime there is heart disease, or most times in different heart disease states, those vessels are affected. Those vessels can become narrow, restricting blood flow. The structures that we talked about, the heart, in the heart, the valves, the ventricles, the atria, all of those issues could have, all of those organs or structures of the heart, sorry about that, components of the heart can also have issues where it disrupts flow, doesn't allow adequate pumping of the heart. There's many conditions that we'll talk about a few of those tonight, very few, but you can have coronary artery disease where there is a blockage or obstruction in the flow of the vessel that supplies oxygen to the heart. You can have vascular disease, again, where there may be aneurysms, outpouching, narrowing of arteries that supply various organs. Heart rhythm disorders, your heart can beat too fast. It can beat over that 100 beats per minute that we discussed, or it can be too slow. And it can bleed so slow that you will pass out. You will feel dizziness, your blood pressure will be low, or it can be very irregular. And a lot of people have heard the term Afib or atrial fibrillation, which is that the heart is beating at an irregular pace. It's not sinus rhythm, which is normally in sync and what we would determine to be on beat, normal rhythm. The heart can beat in an irregular fashion, and what happens is blood will then begin to pool in those structures that we talked about. It can pool in your ventricle, it can pool in your arteries, and because it's doing that and that blood is not ejected throughout the entire body, that will allow clots to form. And if those clots form, which we'll talk about more, those clots can lead to stroke and other issues. You can have structural heart disease, heart failure, and we see this a lot in our community. I see this a lot in clinics, outpatient settings, in the hospital as well, where these individuals, and it could be due to viruses in the past, it could be due to disease called cardiomyopathy, where there is stretching of the heart muscle and the heart is not effective in its pumping mechanisms. And these individuals are fatigued, they're tired. They have several limitations as far as activities are concerned, maybe only able to walk a short distance becoming short of breath. They will have swelling. They also have to limit the amount of fluid they put into their bodies because their heart cannot handle any excess fluid intake. So then we also have all of these diseases, of course, can lead to the need for surgery, restrictions in lifestyle, stroke, and unfortunately death. Heart disease is the leading cause of death in the United States. And I'll talk here a little bit about some of the statistics related to that. So on average, someone dies of heart disease every 36.1 seconds in the United States. And this data is taken from 2019, but, and that was the most recent data I could find, of course, but there are over 2,300 deaths daily due to heart disease. That accounts for greater than 800,000 deaths in the US. Claims more lives each year in the US than all forms of cancer. And I'm going to pause here because as we all know, February is known as Heart Disease Awareness Month. We've heard from the Go Red Foundation, where I kind of got the idea to start those Red Sunday events with the different churches. And we did, and that is important because the American Heart Association recognized that there were some disparities in healthcare in different communities, population types, genders even, definitely in races. And in doing some of their research, they realized that women were just as much affected with heart disease as men. But all of the education that was out, that was popular, was really geared toward men and what their symptoms looked like and what the treatment was for a man. So that organization took on the Go Red event in the hopes of bringing awareness to heart disease in women. And that brought and highlighted the fact that because there's a lot of education out on breast cancer, but it highlighted the fact that more women in the US die from heart disease. It is the leading cause of death than cancer. And just for our population, our ethnicity, our community, it affects approximately 58.8% of African-American females and 61% of African-American males. So what are the risk factors, and are you at risk for heart disease? So there are some factors that we know are beyond our control, and these are things that we can't change if we wanted to. That's our age, our gender, our ethnicity, and our family history. And doing some of the, I just wanted to look back over some things and kind of refresh my memory on some things, but heart disease can affect anyone at any age. A lot of times we will, think of this as a disease that may affect older individuals, but like I said, we went through some of the different various types of heart disease. And, if you think about it, blood pressure, if you have a fast heart rate, all of those are things that could be determined at any age. We can be born with heart defects as well. And some of those are not discovered until adulthood. So gender, females and males can be affected by heart disease. We know in the African-American community, we see more instances of high blood pressure, diabetes that can lead to heart disease, and then a significant family history. And I can talk about myself here, and I plan to do that a lot throughout this talk. So my mother had high blood pressure, and I remember talking to her as a little girl. I actually remember some of the doctor appointments that she went to. And her first diagnosis of high blood pressure was with her first child. And it is coincidental, but my first diagnosis of high blood pressure was also with my first child. So those genetics do play a part, and they're strong. And sometimes despite the modifications that we make in our lifestyle, we cannot get rid of genetics. And then there are things that are within our control, and things that if we need to, we can modify our behaviors to make us even more healthier. And I'm speaking again to myself. So there's lifestyle factors such as diet, watching our weight, increasing our activity, not smoking. If you drink alcohol, decreasing the amount of alcohol, stress reduction, and adequate rest. And then there are health conditions that will further increase or make it even more, or make you even more at risk for developing more heart disease. So high blood pressure, high cholesterol, diabetes, and here I do have pregnancy. And I want to talk there for a minute about pregnancy. A lot of times, new moms do not realize the risks that are associated with becoming pregnant. I look back when I was younger and having my first child, I didn't fully, even though I'm a nurse, didn't fully take into consideration all the things and health issues that can come along with pregnancy. During pregnancy, a woman's body naturally just kind of has more fluid. There's more fluid to handle, and that can definitely add to the risk of cardiomyopathy. And we have seen some very sick individuals at the hospital due to heart disease and pregnancy. our next slide talks about high blood pressure. And I wanted to talk about, I think I have 3 topics that I'll kind of talk heavily on, because I think there are things that affect us more and things that I think we should be more knowledgeable about. So high blood pressure is referred to, you'll see people shorten it to HBP, or they'll call it hypertension or pressure. My pressure's high. It is when those vessels that you have in your body, that there is the force of the blood flowing through those blood vessels is so high and it's consistently high, that it is referred to high blood pressure. High blood pressure is a silent killer. And I'm going to talk about myself again. I guess knowing, I'm trying to remember, like back when I first was diagnosed, I think, initially going to the doctor, blood pressure is a little high, we're going to monitor it. But as it began to get higher, especially during my first pregnancy and even prior to that, I would feel fine. I have been to the doctor, I guess it's been a few years back now, they have my meds really adjusted well. But in years past, I would go to the doctor's office and my blood pressure would be taken and my doctor would almost like die, like, oh my God, do you feel okay? Do we need to call 911? Because my blood pressure would be so high. And I sat there feeling fine. I did not have any headache. I didn't have any vision changes. I didn't feel dizzy, lightheaded, weak, or any of that. So imagine if I was not someone who went to the doctor, and I could do better about going, but somebody who didn't go to the doctor and didn't know what my numbers were, I could be walking around with high blood pressure and actually have no idea. And that happens all the time. If it is left untreated or uncontrolled, it can lead to damage. And this is a conversation I remember my mom having with a provider. I remember my mom being shocked and saying to this doctor, you're the first person who ever said that to me. And what he said to her was, Miss Ford, if you don't get this blood pressure under control, you're going to have problems with your eyes. You're going to end up on dialysis with your kidneys. You may have trouble with your heart. I don't remember him saying anything about stroke, but my blood pressure has been that high, and I'm sure hers had been as high as well at stroke level. So it can lead to very serious problems if left untreated and not controlled. It's important to know your numbers. It's important to go to the doctor. How you got to get the diagnosis. You got to know, like, does it consistently run high? Is it related to, if I drop a few pounds, will my blood pressure decrease? So you got to know your numbers and you got to follow up with your physicians. And that's part of being preventative in your healthcare, is going routinely to those doctor visits. 40% of African Americans have high blood pressure. 52% of hypertensive deaths are in women, and 57.9% of African American women have hypertension. And that's more than any other ethnicity. And in some of the reading that I did learn that there is a lot of study around genetics for African American individuals, and seeing if there is a link or concern for a gene that makes us more sensitive to salt intake, and therefore causes greater incidence of hypertension in our community. This next slide goes over some of the numbers. What is considered high blood pressure? So anything, your blood pressure, 2 numbers, there's a systolic and diastolic, the top number and the bottom number. And that's important to know too. So your top number should be less than 120, and your bottom number should be less than 80. The top number, the systolic number, is the pressure that is exerted when your heart is beating. So how much work is your heart doing? How much pressure is exerted when your heart is beating? And then for your diastolic, which is important as well, this is the amount of pressure or work that the heart is doing or exerting pressure against your artery walls when your heart is at rest. So there's a whole cardiac cycle, and during that cycle, your heart does rest, and it allows the ventricles to fill. And during that time, your heart is at rest. But if this number remains high, is your heart really getting that rest? Is it filling adequately to supply the rest of your body? So elevated blood pressure would be anything greater than 120/80. And I remember these numbers have changed over the years. And I remember when these numbers change, I'll tell on myself again, because I was pretty proud to, I remember thinking, if I keep my blood pressure less than 140/90, it's all good. Well, these numbers have changed. And so it's good to know this information as well. So at this point, if your blood pressure is running like greater than 120/80, your doctor may start to kind of talk to you about like, hey, do you have a family history? Let's talk about, what are you eating? Do you have a lot of activity in your life? What about your lifestyle? Is there anything we can change? Is there anything we can look at? And they'll start kind of having a conversation. As you creep on up to 130s over, 90s and greater, the doctor may start to even talk about more diet and lifestyle modification. And in some instances, they will prescribe medication at this point. But definitely when you get to 140 over 90, the doctor is going to start talking about some meds and some medications that you need to take daily. And they're going to address those modifiable risk factors. And this can be done with your primary care physician for women of childbearing age. And some women tend to follow their OBGYN and let that OBGYN do that. And if you have, certain issues or maybe a strong family history like I do see a cardiologist, and she monitors and prescribes my medications for my blood pressure. And then definitely over 180, over 120 and greater than that. And I will tell on myself again, I have had a blood pressure this high before, sitting in the doctor's office feeling just fine. The doctor definitely is going to be alarmed. If they don't call 911, they're going to be medicating you in the office. If you take your blood pressure and it's this high at home, I would suggest you call your physician right away. You get to if you have to take your meds, you take your meds. But if it's this high, you have other symptoms, dizziness, faint, weakness, numbness, tingling, you need to seek medical treatment right away. This is serious. And if it's coupled with high chest pain, vision changes, all of those things I just named, numbness, tingling, weakness, you need to go to the emergency room. It's very serious. You probably will be admitted. They will try to treat you in the ER with meds, some medications even by IV. But we see several patients that end up in the ICU on medication that is continuously given through their IV to get their blood pressure down. And we monitor that every 15 minutes in the ICU. So for heart attack, let's talk about heart attack. And I don't know if you can see that full slide. If you can't, just let me know. Let me go back to it. So we're going to shift gears just a little bit and talk about what is a heart attack. And this is also referred to as an MI or a myocardial infarction, but heart attack, MI. Some people may say I had a STEMI, I had a non-STEMI. That is the same thing as a heart attack. And this occurs when the blood flow that's been bringing oxygen to the heart muscle is severely reduced or stopped. So if you remember when we were talking about the vessels of the heart and how those heart vessels can either have narrowing, or there could be, your cholesterol's been running high. So there can be a buildup of fat or plaque along the walls of those vessels. And so what that does over time, gradually over time, that vessel will become so narrow that blood can't reach the heart, or oxygenated blood can't reach the heart. And so then that in that area where that blockage occurs, there will be tissue death because there is no blood flow there. and the tissue around that area that has been supplied by that oxygen-rich blood will die, and that is the heart attack. And it prevents blood and oxygen from reaching the muscle of the heart. We're going to talk about the signs and symptoms of a heart attack, but time is tissue, and I want you to remember that tonight and take that away. And you need to call 911. And I can't stress that enough. There's times when people will be like, well, I don't know, I've had this kind of pressure in my chest all day, and if I move, or if I don't move, if I don't breathe too deep, it doesn't hurt. And maybe, I don't know, I should go and see, and kind of been sweaty today. All of those things, don't hesitate to go and get checked out. If you're wrong, it's okay to be wrong. But you want to call 911 in these instances, because EMS, when they arrive, they can start treatment right away. If you're home, or if you have access to an aspirin, take an aspirin, chew that aspirin up right then. And that can also help. But 911, they can put you on the monitor, an EKG monitor, which is a picture of your heart rhythm. They can send that straight to the ER from the ambulance. They can give you oxygen. They can give you aspirin. Can give you morphine, nitroglycerin under your tongue to help those vessels open and help you get some relief. So they can start that treatment right away. So imagine it takes 20 minutes from your house to get to the ER. In those 20 minutes, they could have done all those things, and they're talking to that facility that you're being transferred to. So do not hesitate to call 911. Here is a picture of the heart. And again, these are those vessels that I talked about, those coronary arteries that supply the blood and to the oxygenated blood to the heart. And when those vessels become restricted, or the flow becomes restricted or blocked completely, then the tissue surrounding those vessels, you have a heart attack. And so it says here, the coronary arteries supply blood and oxygen to the muscles of the heart, and they go all around the back front of the heart. Heart attack signs and symptoms: chest discomfort. You'll have discomfort in other areas of the upper body, which could include pain down either arm or both arms or one arm, the back, your neck, your jaw. You could even have pain in your upper stomach, shortness of breath with or without the chest discomfort. And that discomfort in your chest could feel like heavy pressure. I've heard somebody say, it feels like somebody's sitting on my chest. It can feel like a vice grip, somebody squeezing. It can feel like fullness where you just can't get comfortable, or it can be pain, sharp pain. Also, other signs would be becoming diaphoretic, which is a fancy way of saying breaking out in a cold sweat. Some people become nauseated and throw up, become lightheaded as well. And again, you want to call 911, and you don't want to drive. And if you remember earlier, I talked about the differences that we see between men and women, and how those symptoms can be a little bit different for men and women. Classically, over the years, we've all heard of the sweating, the pain in the chest, shortness of breath, heartburn, indigestion, all of those things. But for women, it can be a little bit different. And that's why it's so important that we know our bodies, and we know when something is off, and we listen to our bodies as well. So for women, some of the symptoms can be dizziness, some pain or uncomfortable pain between the shoulder blades, shortness of breath, again, indigestion or gas-like pain, and fatigue and sleep disturbances. And fatigue, unexplained fatigue, like I have no reason to be this tired. Why am I so tired? That it is sometimes a warning sign. And I do know a young lady that had a heart attack, and that was her main symptom. She was so tired, she just couldn't figure out why she was so tired and exhausted all the time. And that was her main symptom. Let's go here. So heart attack treatment, again, you don't want to wait to seek treatment. You don't want to, play around with your heart tissue. And, do I go? Do I not go? Yes, go. And if you're wrong, if it's gas pains, then they can treat you for that and let you come on home. But if you're right, of course, you have, we can do the other interventions that are necessary. So like I talked about already, EMS can start different things. They can do that EKG, which lets the doctor do some diagnosis before you even get to the hospital itself. They can give you some morphine, which not only provides pain relief, but it also allows your vessels to kind of relax, your heart muscle to kind of relax a little bit and get some better oxygenation there. They can provide oxygen, which is essential because right now your heart is like, hey, I'm oxygen starved. Where's the oxygen? And then some nitroglycerin, which will help with pain. And again, keeping those vessels that were so constricted, allowing them to release or relax, and aspirin. The goal is to restore blood flow, and sometimes that means most times that means you got to go to the cath lab, and that's a intervention that is immediate. So you roll into the ER having a heart attack, they're going to attack you. They're going to be doing multiple things at once, getting lab work, getting more tests, and getting you ready to get to the cath lab as soon as possible. Because again, time is tissue. So sometimes you have a heart attack and you only need medical therapy. So the doctor may only put you on some medication to kind of help maybe with, how can I say it, keeping your blood thin. They may require or need to do balloon angioplasty. So a balloon angioplasty is a small balloon that's inserted in the vessel, usually through your groin, but inserted in the vessel, and it will balloon out and it flattens that plaque that's around that vessel that's having issues and allows that blood flow to be restored. Sometimes they may deploy a stent. And a stent is going to stay in place, but that stent also, and it may be a coupling of the angioplasty, so the balloon and the stent, and that stent stays and keeps that vessel open. Or if you have significant blockage that cannot be corrected with the stent or the angioplasty, you may be referred for coronary artery bypass grafting, which is fancy way to say CABG or open heart surgery. And they will take a vessel from elsewhere and bypass the artery or the area of the artery that is blocked or occluded. And then all hospitals don't have the ability to perform this treatment. Some of them can do a cath procedure on you. You can go to their cath lab and they can do up to the stenting or the balloon that they deploy. But some of them you will need to go to another facility to have your CABG. And I'll talk about my mother-in-law here. So my mother-in-law had a heart attack, and this was during the time that COVID, when it still is, but when COVID was surging. And so she gotten up that day, showered, and had a little chest pain, had some chest pressure, and also felt a little short of breath, and a little sweaty. But she took her temp, and she is very good about her healthcare. She took her temp, didn't have a temp, and she called her primary care physician, who said, I think you should go in and get a COVID test because it could be COVID or it could be your heart. So she proceeded to get that checked out, got to the hospital, and then was notified that she had a heart attack. They did what they could at Methodist South, and then she was referred to Germantown. Well, actually, she was going to go to university, but I work at Germantown, so I was like, no, you come to Germantown. So she had to come over to Germantown for her heart surgery. Heart surgery was scheduled a couple of days later, but she developed some chest pain once she arrived to Germantown. And they tried some of the medications that I talked about, the nitroglycerin continuously in the IV to kind of dilate things and help her blood pressure and her chest pain, try to relieve that chest pain. But despite that medication, her chest pain continued. So the surgeon came in emergently and took her to the OR for CABG surgery or open heart surgery. And she had a one vessel CABG, one vessel that was occluded. They were able to bypass that successfully. And she stayed, I'm not sure how many days exactly she was in the hospital, but she ended up doing very well after a while of her recovery. And so she is doing much better. But again, you know, just to touch really lightly on COVID, some of those symptoms can make you think like, is this COVID or is this something else that I need to take, you know, a closer look at? And I'm grateful that her physician, you know, suggested that she go in for testing and actually sent her to the emergency room for that, where they were able to recognize that it was more than just COVID. Trying to see if I wanted to say anything else here. So heart attacks, you know, hopefully if you do have a heart attack, you these treatments will work, you know, will get you in and you know, do the treatments listed here above and that you don't have any issues. But a heart attack can lead to cardiac arrest. There is a vessel that, and it's the LAD, the Widowmaker, that if you get an occlusion there, you definitely will get immediate intervention if they come in and you have that occlusion of the LAD. Because like I said, you know, the heart, the blood flow is stopped and can lead to cardiac arrest. And it's important if you can, you know, learn CPR, attend a CPR class, and be willing to step up and provide help if it comes to that to someone. So CPR, and now they're doing hands-only CPR, where you find someone down, they're unresponsive, you call for help, and then you immediately start CPR. You don't have to worry about giving breaths because the studies have shown that the action of the CPR will, of course, it's going to circulate that blood, restore, you know, the and has the ability to provide oxygenated blood just by you doing the compressions alone. And then if you're in a facility and someone collapses unresponsive, they don't have a pulse and you need to start CPR, hopefully that place or location also has an AED, and you can apply the pads to from the AED to that person's chest, and the AED machine will take you through all those steps. You can, it can identify if the person needs to be shocked. It will tell you if you need to continue CPR. So if you're out and someone collapses, ask for, you know, call for help. Somebody call 911, grab the AED, not you, but the person that is, you know, there'll be bystanders, somebody that can bring you an AED. Lastly, we'll talk about stroke. And so for stroke, I did want to mention that because their stroke risk is so high, especially in our community and our race. And the statistics there say that someone in the US has a stroke every 40 seconds. On average, someone dies of a stroke every 30 minutes and 30 seconds in the US. And based on data from 2019, there are about 411 deaths from stroke each day. So at one point, stroke was seen as the fourth leading cause of death, but now there's a lot of information out on stroke. Again, Go Red events have been huge about talking about stroke. And now it is known, or it is the fifth leading cause of death. So hopefully with the continued medical advances and work around stroke and identification and awareness of stroke, that we will see that number go higher. I wanted to make sure I said it the correct way. So strokes is also seen as a brain attack, and it's essentially almost like what you see in a heart attack, but it occurs in the brain. The stroke symptoms, and this is an acronym, which is the ACT FAST, but the FAST is the acronym to help you fast, um, quickly identify someone who is having a stroke. Again, I have a story around this, but the face drooping, and that is where one side of the face looks to be like slightly lower than the other side of the face. So if you ask the individual to smile, that person will smile and their smile will be asymmetrical. So what it means is like they won't have a normal smile. Part of their smile may even look like a frown. They will have, or possibly will have arm weakness. It may be one arm or the other. Their arm may feel numb or weak. But if you ask them to raise both of their hands, they won't be able to do that, either one side or the other. And if you assist them in raising their arms, they may not be able to keep their arms up. So if you ask me to, bring my arms up, I can't do that. You assist me to raising my arms, and then you let go, one of my arms will immediately fall or it will drift downward. That is a sign as well. Their speech becomes slurred. You may not be able to understand them. They may not be able to say what they are speak clearly to you, or even be able to convey their thoughts to you. So you can ask the person to say something simple. This example says the sky is blue. In stroke, sometimes you may not be able to understand that. You may not be able to, they may not be able to say it back to you. They may just stare at you, or they may try to say it and it will not come out as the sky is blue. And some of these individuals are aware, and so they become very frustrated in that. If you recognize these things, it's time to call 911. So T is for time, and do not hesitate again in calling 911. So this happened to my mom. So my mother was up in Illinois when we lived in Illinois at the time. She was on the phone in my kitchen. I was not home, but my mother-in-law was. And my mother was talking to friends back in Memphis. And so during the conversation, my mother-in-law recognized that like her speech was like a little different. And she was having trouble saying some words. And so she went into her and she called me, thank God, and said, Erica, something's wrong with Shirley. Is her medicine somewhere around? She can't even tell me where her medicine is. And I was like, Granny, hang up with me and call 911. She's having a stroke. And she was like, oh, don't say that. I said, yes, she's having a stroke. Hang up with me. And she was having a stroke. She ended up having to be flown over to St. Louis for them to try to do or take care of the stroke and see if there was anything they could do as far as interventions for her. So definitely you want to recognize that something is different, and then again, call 911 without hesitation. Here's a picture of that just to further illustrate what that looks like, that uneven smile. That person will be trying to, smile for you, and their smile will be uneven. Their arms may be weak. They may not be able to speak again, and then the time. And then just for further points, some people, they don't have to, tell these symptoms, but you definitely want to be aware of the change and make the call. So they can have numbness, tingling, weakness, especially on one side of the body, become confused. The difficulty in speaking, I can't say enough about, or being able to understand their speech, trouble seeing in one or both eyes, trouble walking. So they may be trying to walk, down the hall and may be kind of walking horizontal, can't think of the word, but across the hall instead of straight down the hall. They may lose their balance. They may not have good coordination. And then a severe headache. It's the worst headache of my life. Definitely want to seek treatment. And then treatment for stroke, again, time lost is brain lost. If you think about it like that, just like we talked about with the heart, because again, you can have there's 3 different types of strokes. You can have what is called an ischemic stroke, where there is a clot. And if you remember, we talked about the heart. So the heart, you may have Afib, and this was the case with my mom. She did have an irregular heartbeat, and their thought is that that because the atria, the top of the heart, the bottom of the heart, the top of her heart did what's called atrial fib. So it kind of fibrillates or kind of doesn't pump effectively forward. And so that blood sit there, some of it, and form clots. And then when that blood was pushed down to the ventricles out to the body, that there were little clots, and she had a clot that was sent out into her bloodstream, which stopped and occluded a vessel in her brain. So your blood flow is compromised. You can have a hemorrhagic stroke. So definitely seen with people who have uncontrolled high blood pressure, those vessels over time, because remember, we said there's a constant high pressure in those vessels. And we know anything that is a, hose, even with a high pressure constantly flowing through it and it never is relieved, it's going to weaken the wall of that vessel. If you want to talk about a vessel, weaken the wall of that vessel, and it eventually it ruptures, and that then blood is everywhere, and that is a hemorrhagic stroke. Or you can have a transient ischemic attack, which is a TIA. Some people call those a mini stroke, where you have these issues where you have just a transient episode of having stroke-like symptoms, and then it's resolved. You still need to seek treatment for that, and it still can be serious, even though the resolution doesn't require any medication. Treatment for those, you need to come to the ER. And again, in the ER, they're going to do a medication that is a clot buster. And you have to meet some requirements. And so time is one of those requirements in order to be able to receive this clot busting medication. Also age, but several people receive this medication, and it does work. It will, if let's say you are having trouble with your speech, or you may be having weakness in one side of the body or extremity, this medication sometimes does work, a lot of times does work, and causes those symptoms to improve within a few hours of receiving the medication. And then in some instances, they can go in, it's called a thrombectomy, and they can place a stent through your groin all the way up, and then they can remove that clot or pull that clot out, and you have resolution of symptoms as well. Stroke can be massive and can lead to death. I don't have that here, but it can be. But having a stroke doesn't mean that life is over. It doesn't mean that you cannot recover or regain some of the abilities that you have maybe lost due to the stroke. So I'm near the end because I think I'm maybe well over time. I'm not sure. I'm a talker, but just some heart health tips in general. And I kind of mentioned these as we went along. You want to know your body. You want to know when things are off with your body, and you want to seek why do I feel strange? Why do I not feel like myself? And you got to, you may have to be a little bit aggressive to get those answers sometimes, realizing when you don't feel like yourself and knowing when things are off with your body. You know your body, and you have to be able to communicate that and let others know. Know your medical history. How I can't tell you how important this is. What medications you're on. What's your family's medical history? That's important to know as well. And don't keep any secrets. Sometimes people come in and they don't want to tell us about things. They don't want to tell us, I used to be on this med and I just stopped taking it because I thought I was better. Know your medical history and share what's going on. Also, know the name of your medications. I was on a talk recently with my cardiologist who was talking about the same thing, heart health in women, knowing their heart history. And she was like, I'm not saying you gotta memorize every name and dose, but carry something with your medication so that you're able to tell your physician what meds you're on. I don't know if I don't have this on the list, but don't just stop taking your medicines. If you're prescribed something and it's making you feel bad, especially blood pressure medicine makes you tired sometimes, it may not make you feel the greatest. talk with your physician before stopping the medication. I cannot tell you the number of patients we've had that have spent a night in the ICU, night or two in the ICU or more, because they decided, well, my blood pressure is better, or I hate the way this makes me feel, so I'm just going to not take any medication at all. You really should at that point have a conversation with your physician and say, hey, this makes me tired. Hey, it gives me a headache. Whatever the case, and get something else prescribed. There are a ton of blood pressure medications on the market, and you want to, seek one that works for you. And then if you, for some reason, make all those lifestyle changes that we talked about and you're able to get off of them and your doctor says it's time to get off, then yes, get off of them. But don't just willy-nilly take yourself off your medications. Take as directed if prescribed. Get your routine physicals and follow-ups, exams as well, and then exercise. I'm fussing at myself here. Get up and walk around, do some activities, get out of the house. I know it's the pandemic, but walk in your neighborhood, join some virtual bike group or whatever it is, but have some physical activity, maintain a healthy diet. Reduce stress. I can't talk about stress enough. And I wanted to put this other topic on there, but I felt like I'd run out of time. But stress is serious, you all. There used to be a saying, the stress will kill you. It will. Reduce your stress. If you find yourself that you're stressed out often, let's look for ways that we can reduce our stress. That may mean that I can't say yes to everybody that helps me do something. That may mean that at work, I may have to take my lunch break and go sit, out on the bench, out on the parking lot, so that I don't, I'm stressed constantly. But find ways. There's a lot of things about mindfulness. If you have an Apple Watch, it'll tell you, take a deep breath, close your eyes, take some deep breaths, do whatever you need to do to reduce your stress. And then we do have to get adequate rest, and it's tough and challenging as well. But rest and adequate rest, good night's sleep is important as well in maintaining our health and our heart health. I'll stop right now and open it back up for questions and try to stop screen sharing so I can see you guys too. See.
Thank you so much, Erica. Wonderful presentation.
You're welcome.
Wonderful presentation. Let's give her some emojis. She did a great job tonight. Thank you so much. Thank you so much. I have a question in the chat.
Okay.
From Miss Linda.
Mm-hmm.
She says she heard menopause can cause increase in cholesterol, weight gain, and hypertension. These are risk factors for heart disease. With taking medication for menopause, let me scroll down, hold on just a minute. With taking medication for menopause, make it worse for your heart?
That is a good question, and maybe one that I can't fully answer. That may be better directed toward a physician, but yes, menopause can bring about changes in our bodies and actually increase some of the risks that we talked about too. But that question may be better answered by a provider rather than me, little Erica RN. But Sister Linda, I see Dr. Young all of the time. I can ask her that. That's a good question.
Erica, you stated about being controlled. Your blood pressure is controlled with medication now.
Yes.
How long did that take? And what was your journey to getting to this controlled state?
I had to grow up, y'all. I really did. I will tell on myself. I kind of fell in that category, especially when I was younger. I never felt bad. I did not feel bad. And so the physician, I remember even when I was in Illinois, they would tell me to journal, keep a journal of my blood pressure, readings, take my blood pressure consistently. And that way I would know, are the meds working or not. But I guess probably becoming a caregiver for my mom and just seeing, the journey that she went through, it probably, you know, then was when I was like, okay, this is serious and I got to take this serious. I got to get in control of my health. How can I be a nurse? And, you know, talking to people every day about different things, and I'm not taking care of myself. So I did start to see Dr. Young, and I see her more than I see any other provider. And she worked to get my meds in a good spot. Dr. Young, her name is Lisa Young. She's a cardiologist with Sutherland Cardiology in Memphis. And she's African American as well, and just really down to earth. But she worked with me really over a period of time to get my blood pressure controlled. And then I just, you know, I talked to her because I had been on medications before, like I mentioned, that, oh man, I mean, made me extremely tired. I couldn't function. So she was like, well, you may take that at night, but I want you to remain on these meds. So I just began to like, okay, I'm going to take my meds always. And if I have an issue with the medication, I'm going to let her know. And it definitely, working in the hospital and seeing some of the things that happen definitely will change your mindset. So my journey was probably a little longer than it had to be, but due to my own, you know, me being hard-headed myself, but definitely is much better controlled now. And I can tell now when my blood pressure is high. And it was probably things that I was ignoring, because I definitely can tell if I miss a med, you know, like fall asleep and then take something and wake up, I will know. There's things like, yeah, like little signs, subtle signs, and that's knowing your body. Like sometimes I'll feel like, oh, it's like, man, just a little pressure right back behind the back of my neck, you know, or I might have just a little bit of headache, and I don't have headache. So just a little headache, that makes me like, what's my blood pressure? Yeah.
There's a question in the chat. Are women still at risk for any heart conditions after experiencing hypertension with pregnancy?
Yes, absolutely. So that cardiomyopathy that I talked about, where the heart is, the muscle is so stretched and can't pump effectively, some of those women are told not to have children again. I have seen some of them be hard-headed and have a child again anyway. And I remember a young lady in Illinois, up there in Belleville. We prayed over this young lady, physician included, because we thought this young girl was going to pass away in our presence. And she actually lived, and they told her, I remember the physician telling her, all of them, you know, you do not want to have another child. And she came back in several years later, had another child, and actually did okay. But, you know, it definitely is a risk. I had preeclampsia during my pregnancies with my girls, both girls. So blood pressure sky high, having to do all kind of monitoring at home, hospitalized earlier. And I remember I was, you know, after the second baby, and Charlize had to actually stay in the NICU because she was born early. I was like, well, can I have another baby? And the physician said, you know, preeclampsia, it doesn't work like that. It's not where you're preeclamptic with the first child. It's a little bit worse with the second child and the third child. Oh my gosh, it is, it may be, it may not be. And it's sort of, we would have to monitor you to see. And I actually did have a third child, and Caitlin was my best pregnancy of all. So it's just, you just don't know. But yes, definitely, if you have pregnancy issues, and let me just say this too, and I will be quiet, but if you have any issue in pregnancy, swelling, you don't feel the baby's heartbeat, you're having difficulty breathing, you make that physician listen and see you. I've seen too many instances where we weren't listened to, and things could have turned out a little bit better had we been listened to. So if you know your body, and if things are off and are not sane, you need to call your physician.
Wonderful. Any other questions from the participants left on the call? Any questions, any comments?
Yes, I have a question. Yeah, Erica, I want to know why I have to have a procedure. I have to have a loop recorder done.
Uh-huh.
And what can I expect with that?
That it I'm not as familiar with the loop recorder. I know I've heard of it, but I'm not as familiar with it. But I can let you know. I will look it up and let you know.
Any other questions or comments?
Yeah, just one. Well, I guess one of both. Thank you so much.
Yay,
That
you're
was
welcome.
very informative, and thank you so much for recording. Because I think individuals who may have missed it would want to definitely hear it. So I think it was some really good information. One of the things you talked about was adequate sleep. And, you know, I guess that could vary with individuals. You know, I've told the doctor that, you know what, if I wake up at 5 a.m. in the morning and I feel fine, then the doctor says your body has had enough sleep. So is there technically where you should get to a point where you do really need to get more than, 6 hours of sleep? Or maybe your body does not, I don't know.
Yes, I think that it is somewhat individualized. I know for myself, I need to go to bed earlier, y'all. Let's just be truthful. And the days when I kind of meet that goal and I go ahead and go to bed, and it's not always 8 hours of sleep. It may be between 6 to 7 hours of sleep. I am like a different person. However, Netflix is the devil, and I will start a series because of somebody's recommendation. And I will be like, I'm just gonna watch one more. And the next day I pay for that and I feel different. And my attitude is probably not the best. I mean, so, just imagine your body not getting that adequate rest. Now, I do know a physician, he says 4 hours of sleep is a wonderful thing. He doesn't need any more than that. He cannot sleep any more than that. And he feels great. Not Erica. So I think it really is individualized as far as you knowing your body and what you need as an individual. There are some early risers. I wish it was me. I'm not. And if you can get up, you get up and you're bouncy at 5 a.m., just know that Erica's very jealous of you because I am not. But definitely, I feel like it's individualized and you got to know for you, what is that adequate amount of rest? I do think you can, lay around too long as well, but definitely what that adequate amount of rest is for you as an individual.
Erica, do you know I'm going to ask this question and I'm going to let people go. I know our time has been far well spent. What the percentage is of people who come off of medication, high blood pressure medication, once they've been on it for a while? Do you have an idea what that percentage level looks like for folks who are actually able to come off of medication?
I don't. I looked at a few things about high blood pressure this afternoon, and I didn't really see that, that percent, but I think it's doable. I feel like it's doable because I've seen some people, and I mean, I guess it's genetic too, but I have seen some people be able to, especially, altering changing their lifestyle, losing weight, change your diet, especially. I've seen a lot of people be able to, but I do know, I know, I will never forget this girl told me she had hypertension, as petite as she could be, thin, works out, does all the things, and has high blood pressure. So, some of that comes into play as well. But I think, definitely something that is achievable with, if that's what is causing your pressure to be so high, making those changes definitely will lead to even getting off multiple medications or getting off all medications. Same thing with diabetes.
Well, we thank you so much for your time.
Yeah.
Thank you for that great presentation.
I enjoyed it.
We appreciate you and the Northeast Side Church of Christ. Tell Brother Stokes we said hello.
Yes.
I will. He's on here, I think. Yes, he is.
Hey, Brother Stokes. We appreciate you lending Sister Liggins to us tonight and informing us of our heart health. So thank you so much. Y'all take care and have a wonderful rest of your night.
Thank you, Sister Erica. Awesome job.
Yes,
Thank
sir.
you so much.
Thank you. Thank you for having me. I enjoyed it.
Good night, everybody.
Good
Thank
night.
you.
Good night. Thanks,